I found SURC to be an invaluable part of my cancer treatment. Having that security, knowing that I could call someone at any time, no matter what I was going through, was just absolutely wonderful.
SURC stands for a Symptom and Urgent Review Clinic for cancer patients having treatment here at Ballarat Regional Integrated Cancer Centre, also known as BRICC. They can call SURC at any time if they've got any questions or concerns about side effects or symptoms they're experiencing, and have access to a specialised oncology nurse to provide education and support to them.
SURC meant a great deal to me while I was having my treatment. It was the first time that I've ever had chemotherapy, and I didn't know what to expect. It was quite a frightening time, and having that fridge magnet on my fridge with a list of all the possible symptoms, and being able to just check whether what I was experiencing was normal and whether I did need to call was just a great peace of mind. So it was very helpful.
Our SURC clinic has been a significant benefit for our patients who are receiving cancer treatment. For those people experiencing side effects or complication of those treatments, it allows early access to appropriate medical care. We've seen fewer ED presentations and hospital admissions, and people experiencing fewer side effects for both those accessing SURC clinic.
The SURC clinic is very good because it gets the right patient to the right place at the right time. So for our oncology patients, it means that they can avoid the emergency department and they get to see the proper individuals with expertise in their care, and often the person they're talking to will actually know the patient as well.
When you're going through treatment, you're so fatigued, and you're often experiencing symptoms that aren't pleasant. And having the SURC service there meant that I didn't have to leave the house on several occasions to visit my GP or go to the ED, because I had a remedy on the phone and I had that support as well.
So in an 18-month period, we've had over 2,500 contacts, and 80% of those contacts have been phone calls, and 20% of those contacts have been patients coming into SURC to be reviewed by the nursing and medical team.
I think SURC helps our patients in our job. It's a little bit hard to see the people that don't turn up. You just see the people that do turn up. So in reducing the overall emergency department numbers, it's useful, but I think its greatest benefit is to our oncology patients.
So when patients have their treatment here at BRICC, they have access to SURC from start of treatment right through their cancer trajectory till the end of treatment, right up until 3 months after their final treatment that's given.
SURC can be a resource for both GPs and community health clinics. So if you've got a patient that you might have previously sent to the emergency department, you can talk to the SURC clinic staff and they may be able to give advice where the GP or the community health worker is then comfortable treating the patient themselves, or they may find the patient is suitable to come into the SURC clinic rather than the emergency department.
I know I've got a clear point of contact to refer my patients to. And I know if my patients are experiencing side effects, so they've got that point of contact to access advice very early on in the course of their treatment.
I found SURC to be an invaluable part of my cancer treatment. Having that security, knowing that I could call someone at any time, no matter what I was going through, was just absolutely wonderful. And I would strongly encourage people to use it who are going through the same thing. It's just, it will save you a lot of angst and give you a great deal of support.